And good morning, everyone. Here we are, Doctors of Podiatry. We're here with Dr. Fernandez. And I'm just going to try to get through here. So I'd like to present a case to you guys of a patient that recently had surgery. And the reason why she has this ulceration on the side of the foot is because of a, correct me if I'm wrong, Dr. Fernandez, a very prominent styloid process or a bony prominence.
She actually went to a pedicurist who unfortunately did not treat her the best and essentially scraped the side of her foot with it. Was a, what would you say it was?
Yeah, like the scraper thing.
A scraper, like a callus smoother.
Yeah.
And she did have a prominent styloid, and what ended up happening was it caused a wound, and it became a problem.
Get in here. Sorry about that. So we're removing some sutures, and you're going to go ahead and clean the surrounding callus to really get an idea and to really appreciate the underlying problem. Correct?
Correct.
Dr. Fernandez is working it there. Several years ago, I actually did on Channel 7, I did a story on, it was called Pedicure Nightmares, and it was exactly that. For a certain amount of time, we were having these patients come in with a significant amount of paronychias, a lot of infections in their toes, and it was kind of like an epidemic. A lot of people were coming in, and people need to really take these things very seriously. Some of these salons they don't follow the necessary and proper protocols in respect to the hygiene, and it's a big problem. It's an underregulated arena, and that's what happens. Aside from the fact that maybe these are high risk patients that are going into these salons to get pedicures and manicures, and the individuals performing these services are not qualified to really render the type of care that these patients need. Whether it's a diabetic patient, whether it's a patient with vascular disease, or any other medical issues. And again, that's a technique that we use just to stimulate the area to produce more blood flow to the area. Now as everyone can see, we're getting a better idea of the size of the ulceration. Our main concern in these situations is to make sure that the bone is not in close proximity. That's our main concern, and it is not. This is very important because that can obviously clearly lead to other major complications, and we want to avoid that at all costs. Jaws Podiatry here, where the saying is basically, saving limbs, saving lives. So I'm gonna go ahead and cut it short here. I hope everyone has enjoyed this video, And Dr. Hugo will eventually, clean up the rest. We'll wrap it up, and we'll continue to implement advanced local wound care therapies with other modalities as well. Thank you for watching.